Hi there, welcome in. So you're here because you're not feeling all that good, right? Alright. So I'm just going to get your temperature with this temperature gun. I'm just going to put it in this ear. Alright, just relax. Okay, your temperature is a bit high, but let me just check your other ear, okay? So your temperature is pretty high, which I think is probably causing you to not feel all that great. Alright, can you just look at me? Do you feel any pain along your nose, your forehead? Okay, just going to touch your face. Alright, I'm just going to palpate your face. Let me know if you feel any pain. Alright. Okay, now I'm going to do the same thing but with this tool, but it's going to go on my fingers, okay? Alright, just relax. Okay, any pain? Gotcha. I'm gonna take my otoscope and just look at both of your ears. Just want to make sure what's going on in there, your ear canal, making sure that everything looks good. Okay, I'm gonna put it in this ear first. Please stay still for me. Okay. Very good. Let me look at the other ear. Same thing there. Looks pretty good. I did see a little bit of redness on this side, but not too bad. I'm going to use the same tool and just look at your eyes. I want to see if there's any redness, anything going on there. Okay. Just going to take a quick look. Alright. Just look at my nose. Okay. Good. Can you look over here where my finger is? Okay, good. Alright, now I'll look at your other eye. Just look at my nose, okay? Look at my nose, even though this is blocking it. Okay. Can you look where my finger is? Where my finger is. Very good. Okay, I'm just gonna look right here again. Look where my finger is. Look where my finger is. Good. 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 Okay, same thing over here. Just look where my finger is. Where my finger is. Good. Okay. I'm going to check your lungs and your heart. So I just want you to sit up for me. Okay. Alright. So I'm gonna put this against your chest. I just want you to take a deep breath, okay? Good. Okay. Now I want you to just breathe normally. Alright, very good. Just breathe normally. Just breathe normally. Good. Take another deep breath for me. Good. Take another one. Good. Another. Another. Good. Okay, now I'm gonna put this behind you now. Alright, now just breathe normally. Okay, good. Just breathe normally. Can you take a deep breath for me? Good. Take another deep breath. Another one. Can you cough for me? Very good. Alright, now just breathe normally. Good. Okay. So your heart and your lungs sound good. Your heart sounds good. Your lungs, I hear a bit of wheezing when you're breathing. So that sometimes happens when there's phlegm. So that's probably what's going on there. I'm just going to look in your mouth. I have this light. So I just want you to open your mouth wide for me. I'm going to put this here. I'm just going to try to look inside your throat. I have this light here. So say ah for me. Say ah. Very good. Good. Okay, I do see some redness in your throat. Yeah. Okay. Yeah. Okay, you can close your mouth now. Yeah, I am seeing redness in your throat. I'm going to be touching along your neck, your lymph nodes. So I just want you to relax and let me know if you feel any pain. Okay. Okay. No pain. Good job. Yeah, it feels pretty good. I'm not feeling any bumps or any area that's a little bit bigger. It looks good. No swollen lymph nodes. Okay, very good. I want you to look at my light. Alright. Okay, just keep looking at my light. Look at my finger here. Okay. Look over here. Over here. Look at my light. Over here. Over here. Over here. Okay. Now I want you to follow my light with just your eyes, not your head. Okay. Good. You're doing great. Good. Just follow my light. Now tell me when the light leaves your vision, okay? Just keep looking straight at me. Good. You're doing great. Now fully out. Very good. Perfect. Okay, let me know when it enters your vision. Good. Good. Okay, nothing wrong there. Not seeing any issues. I want you to just look here. Look at my hand. Tell me how many fingers I'm holding up, okay? Good. Good. Okay, same thing here. Good. Perfect. Okay. Yeah, we just need to make sure that your overall health is good when we do these examinations. I just want to make sure that you're able to see how many fingers I'm holding up and able to comprehend that. I'm just going to get your measurements. I want to see how tall you are. Okay, just stand still. Good. Let me see here. Good. So it looks like you're the same height as last year. Okay. Alright, now I'm going to be checking your ears. Okay. So I'm just going to look again with my otoscope, get a better look. Alright, so just relax for me. I'm going to be looking in this ear here. Okay. Let me look at the other ear. Yeah, so I do see redness on this ear. The other one's looking good. That's kind of interesting. We're gonna do a little hearing test. So I need you to close your eyes. I have this little remote. Makes that sound. I want you to tell me how many times you hear this sound. Okay? Keep your eyes closed. Okay, how many times was that? Good. Okay, let's do it again. Okay, how many times was that? Good, that one was 10. Now I'm going to be using a tuning fork. Keep your eyes closed, and I want you to tell me when you hear the sound stop. Good. Very good. Okay. We're going to use a different frequency. Okay, keep your eyes closed and tell me when the sound stops. Good. Very good. Okay, last frequency. So tell me when the sound stops. you can open your eyes now. You did really, really good. Now I'm just going to be examining your ears. So just relax. Any pain on this ear? Okay. Okay. Now let me look at the other ear. Any pain on this one? Gotcha. So, no pain on either ears. That's a really good sign. Alright, so I'm just going to use this tool here, and it's actually going to be putting liquid in both of your ears to help with that redness. Okay, so just relax. I'm going to put it in both ears. So I'm just going to be putting 3 drops on both ears. Okay? Alright, just relax. Okay, that was one. Let's go on the other one. Good. The other one. The other one. Okay, the other one. And now let's do the other one. Beautiful. Okay, so that should help with the redness, but we will be bringing this home with you so that you can use it throughout the week to help with that redness. If you feel any irritation, this will help, okay? So that's one of the medications we'll be bringing home with you. Okay, so lastly, I just want to make sure here how well your vision is. Okay, so I just want you to look at the smallest line you can read. Okay. Yeah. Okay, very good. Right, other eye. Same thing. Just let me know what is the smallest line you can read. Very good. Very good. Very good. Okay. So we looked at everything, and I can see that you just have a little cold right now. You did have some redness, like I explained before, in your ear, and a little bit of redness in your throat. We are going to be bringing this tool for you that you can take home, and you're going to be putting 1 drop in each ear every day, and that's going to help with that redness. And then we are going to be sending a different medication for your throat, and it's supposed to help your overall health. So it's supposed to help with your ear as well. And if you end up getting anything else while you're sick, any more symptoms, it's supposed to help with that. But that will be sent to your pharmacy. But yeah, that is the end of our appointment today. And it was very lovely to meet you. And I hope you have a lovely rest of your evening. Alright, I will see you around. Bye-bye. Hi there, I'm Dr. Rose. Welcome in. So, I heard that you got hit in the head. Is that correct? Okay, well, I'm glad that you came in to book an appointment, because after getting hit in the head, it's important to make sure that everything is going well, checking your cranial nerves. So we'll get started right away. I'm just going to put on some gloves. Okay, so So do you feel any pain where you hit your head? Okay. How about your eyesight? Anything weird with your eyesight going on? Okay. Well, I'm just going to take a look at your eyes. Usually the eyes are the best way to tell if something is wrong. So sometimes your pupil might be two different sizes. Sometimes you don't follow the light correctly. So I do have this light here and I need you to follow it, okay? Just follow this light. Good. Does the light hurt your eyes? Okay. Is it hard to follow? Try not to follow with your head, just your eyes, okay? Okay, very good. Can you follow my finger? Okay. Now don't pay attention to the light. Just follow my finger. Very good. Just follow my finger. Even when the light is in front of the finger, just follow my finger. Good. Okay. Now I want you to look at the light. Look at my finger. Now look at my nose. Okay? Now I'm going to be giving you instructions like that. So just follow the instructions, okay? So follow my finger. Now look at my nose. Look at my finger. Okay. Follow the light. Now look at my finger. Good. Look at my nose. Okay, look at the light. Look at the light. Look at my nose. Good. Look at my finger. And the light. Very good. Okay, just look at my nose for now. Tell me when the light leaves your vision. Good. Okay, tell me when the light enters your vision, okay? Just keep a look at my nose. Very good. Like I mentioned before, you need to look at your pupils, make sure that they're the same size. I have this measurement tool. I just need you to just look at my nose and try to keep your eyes open, okay? Okay, I just want to make sure that they are both the same size. Okay. Good. And just keep looking where my nose would be. I know it's kind of blocking your vision, but just keep looking in the same area. So the distance between your pupils are good, and then the actual size of your pupils, I'm just gonna double check. I have this, we're gonna be using it, but I just want to check the pupil, how big your pupil is. Okay. Very good. Okay. So they are a normal size and they are the same size. So that's a very good indicator that there might not be too much going on. Just gotta make sure they are. Okay, so let me just take this off. I'm gonna look at your eyes. So So just try to keep your eyes open. Okay, don't blink, don't blink, don't blink, don't blink. Okay, you can blink. Good. We're gonna do the other eye. So don't blink, don't blink, don't blink. Don't blink, don't blink, don't blink. Very good. Okay, now you can blink. I'm going to be giving you some instructions when I'm looking at your eyes with this tool. So, just going to put this light here again. Okay, so I want you to look up for me. Good. Now look down. Good. Look right. And now look left. Perfect. Okay, and we're going to do the same thing with your other eye. So, look up for me. Now look down. Look left. Good. Now look right. Perfect. Okay. So that looks really good. We're just looking really deep in your eyes. Okay. I'm going to cover one eye, and I want you to read the smallest line that you can read, okay? All right, you can begin. Okay. Very good. Okay. Now other side, same thing. I want you to read the smallest line that you can read. Very good. Okay. We're going to cover the same eye. So you can see right here. Okay. I want you to tell me how many fingers I'm holding up, okay? All right, let's begin. Good. Other side. Okay. Can you see my hand? Okay. How many fingers am I holding up? Perfect. Okay. I have these little squares in here that are all different colors. Okay, so I'm going to put a light on one of them, okay? So you gotta remember the color. Okay, so you see the colors. Okay, so first we're gonna do it without the light. So, what color is this? Good. And what color is this? And this color? And this color? Good. This color? And this color? This color? This color. Okay. So, now let's look at this one, okay? What color is that? What color was this? What color was this? What color was this? Okay. What color is this? This. And this. This color. Okay. What color is this? And this. And this. And here. Okay. Here. 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 Very good. Yeah. So you did really well. these different colors. Okay. Let's do another color test. What color is this? Good. I'm going to make a shape. Tell me what shape that you see. Good. That was a square. I have another color. What color is this? Good. Now I'm going to make a shape. What shape? Good. Okay, last color. What color is this? Okay, good. Now I'm going to make a shape. What shape? Good. That's a triangle. Fantastic. Okay, so your eye health looking really good. Not concerned there. Not seeing any issues. Okay, now we're going to move on with your hearing. I'm going just to take a look inside. Sometimes you can see swelling within your ears. So if you look with an otoscope, so I'm going to look at both of your ears quickly. Just relax. Okay, good. Now let's look at the other ear. Okay, good. Okay. Both ears look good. I didn't see any swelling, so that's a good sign. Now we're going to test your hearing. Okay, so I want you to close your eyes for a big portion of this. Okay, so close your eyes. Okay, so I'm going to be using my hand, and you're going to tell me how many times you hear this sound, okay? All right, let's begin. How many times? Good, that was 7. Let's do it again. How many times? Good, that was 5. Again. That was 10. Very good. Okay, now I have a tuning fork, and this makes this sound. So I want you to tell me when the sound stops, okay? Very good. 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 Perfect. Now I want you to tell me on what side you hear the tuning fork, so either left or right. What side did you hear that? Good. What side did you hear that? What side did you hear that? What side did you hear that? Very, very good. Okay, we're going to do that same thing but with my fingers. So tell me what side you hear that sound, okay? Good. Very, very good. Okay, your hearing is fantastic. There's no issues there. You can go ahead and open your eyes. Now we're gonna look into your face. Okay. I'm just going to take this little hammer here. And you're gonna tell me if you can feel that. Okay. I'm gonna be like pressing it up against you. Don't worry. It's super gentle. Okay. So let me know when you can feel it. So you can close your eyes for this one as well. Okay. So close your eyes. Tell me when you can feel the hammer. Perfect. Okay. So I want you to follow my instructions now. So I want you to smile. Very good. Now I want you to frown. Okay. Good. I want you to puck your lips. Good. Okay. Now can you wrinkle your forehead? Perfect. Okay. Now, let's see. I'm going to use the two different objects. So I have a fan and then I have the hammer again. So you know how the hammer feels, but now I'm gonna brush the fan. Okay, so the fan is supposed to be soft. The hammer is hard. So I want you to tell me which one you're feeling. Okay? Alright, so close your eyes for this one. Alright, so let's see. Which one are you feeling? What was that? Good, that was the hammer. What was that? Good, that was the fan. Hammer. That was the fan. Good. Hammer. Fan. Hammer. Fan. Hammer. Very good. Okay. Now, I want you to say for me. So open your mouth wide. Okay, I'm just gonna take a look at your throat. So say for me. Okay. Okay, good. Everything looks good there. So I have a smell and taste test. So I have this here, and this has some liquid. So I want you to just open your mouth and you're gonna tell me what you taste, okay? Alright. What does that taste like? Good. Strawberry. Let's do another one. Okay. What does that taste like? Bananas. Good. Let's do another one. What does that taste like? Coffee. Very good. Now let's do one last one. This one might be a little tough. Okay. roses. Very good. Okay, now we're gonna do a smell test. So I have kind of the, like, almost the same tool, but this one has a fragrance that sprays your nose. Okay, so let's get, what did that smell like? Good. Smell like coffee. Okay, let's do it again. What did that smell like? Roses. Very good. Okay. What did that smell like? Bananas. Good. Okay. Now last one. What did that smell like? Lavender. Very, very good. All right, we are all done with your cranial nerve exam. Everything looks fantastic. I'm not concerned about anything at all. But if you do feel like there might be something going on, you could definitely book another appointment or give our office a call. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening. All right, I'll see you around. Bye-bye. Oh, hi there. Welcome in. So, you must be the next appointment, correct? Okay. Can I get your name, and can you spell your last name for me? Okay. And can I get your date of birth? Okay. All right, so what are you here for today? Okay. So, a super detailed ear exam, and that comes with the hearing test. Okay. Have you had any issues with your hearing the past week? Okay. Have you had the exam with us before? Gotcha. Okay. Well, we can get started. I'm just going to take a quick look at you. So I have this light. I'm just going to be looking at your ears, just the outer, making sure that everything already just looks good. So you're saying that your hearing hasn't really changed in the last week, and there's not many issues with your ears. So yeah, we'll make sure that everything is looking good. Even though you're not having any issues, it's good that you're looking into your ear health. So already I'm not seeing any bumps, I'm not seeing redness. Everything looks really healthy. I am just going to put some gloves on. I'm going to be touching your ear. Is that okay with you? Alright, great. So we will be doing, like I said, a super detailed ear exam, which entails a hearing test. So we will be putting these headphones on your ears, and there will be different beat tests, different things that we'll be doing. So now we can get started with touching your ear. Okay, just relax for me. Okay, if you feel discomfort, let me know. Okay. Did you feel any discomfort there? Okay. Now let's try this one. discomfort there? Okay. Very good. So, turn off my light. I'm gonna get your temperature quickly. Just want to make sure that you're not sick. So just relax. I'm gonna be doing it on your forehead. Okay. And then let's see. Okay. Good temperature. I have a different temperature gun that actually goes in your ear. So we're gonna start off with that one. Okay. Good temperature. Now we're gonna do the other ear. Just want to make sure. Okay. Good temperature here as well. Okay. Nothing to be worried about there. I'm going to look inside your ears with this otoscope. So this is just going to let me see deeper in your ear canal, making sure that everything is healthy. If there's any wax, we will be cleaning that up. So yeah, we'll be looking at this ear first. So just relax for me. Very good. Let me look at this ear now. Great. So I did see some wax buildup that we will be cleaning for you, and then we'll get on with the hearing test. So let me just get those tools out. Okay. So I have this here. It's a little pick. I'm just going to be picking inside your ears, and then after I will be using this to put some liquid in your ear. So if you feel discomfort, let me know. We're going to start off with this ear. Very good. I'm going to do the liquid now. Just relax. Good. Now, let's do your other ear. Very good. Let me now use the liquid. Okay. Now, how do your ears feel? Okay. Interesting. I'm just going to lightly touch. Let me know if you feel any pain. otoscope. Just want to make sure that everything looks good inside. Just relax. Very good. Let me look at the other one. Very good. Yeah, things look good inside. Just going to take this red light. Just want to make sure that the outer of the ear actually looks good. Just going to be like kind of scanning your ears. Okay. Great. Now we can move on to our hearing test. So I'm just going to use this tuning fork. So this is just a basic test that I'm going to run on you. All you have to do is tell me when the sound stops. Okay? All right. Good. 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 Very good. So now we are going to be doing the headphones hearing test. There's going to be a bunch of different instructions I will be giving you, and I'll be telling you what you should be doing when the time comes. So let's get ready to put the headphones on you. So just relax. So I have these headphones for you. We will be putting them on. Good. And hear me out this side. Good. We're going to get started now. Alright, so now we are ready for the hearing test. First instruction is you're going to tell me how many times you hear the sound. Just keep taking notes. So if you have any questions, feel free to let me know or stop the tape. Let's begin. How many times do you hear the sound? Very good. And tell me when the sound stops.
isn't when you hear the click. How many times do you hear the click? Which ear do you hear the sound? How many beats do you hear? They are going to be grouped up, so it could be a bit tricky. So how many beats does that? Now tell me when you hear the higher pitched beat. How many clicks do you hear? Tell me when you hear the higher pitched beat. What ear do you hear the beep? Alright, that is all for our hearing test. And just take the heavy.
You did fantastic. Everything sounded great. You got none of the answers wrong. So I am going to just put these eardrops in your ear. We're going to be actually bringing these home with you. They have a little vibrate that pushes air and liquid in your ear. So this is because we did that ear cleaning on you. We don't want you to get irritated inside your ear canal. So we're just going to put a little bit on right now, okay? Good. So one drop is enough for both ears, okay? Okay. So yeah, that is it for our ear exam today. Like I said, everything looks really good. Your ears inside look really good now that we did a little bit of a cleaning. The hearing test was perfect. You passed with flying colors. Yeah, overall your ear health is really, really good. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening, okay? Alright, well, I'll see you at your next appointment. Alright, bye-bye. Hi there, you can come take a seat. So you're here for a yearly doctor's appointment, correct? Okay, well, we can get started right away. I'm just going to get your temperature. So this temperature gun goes on your forehead and your cheeks. So just stay still. Good. Now one more time. Okay, good temperature there. I'm just going to check your ears as well. So this is a different temperature gun that goes inside your ears. So just stay still. Good. Now I'm going to do the other ear. Okay. All right, very good temperature, no concerns there. And let me see, I'm just going to take this otoscope and look in both of your ears quickly. So just stay still. Very good. Let me look at your other ear here. Great. Okay. Okay, so your ears look good as well. Do you have any concerns going into this appointment? Okay, so just a yearly. Gotcha. I have this measuring tape. I'm just going to measure you. Very good. Okay, so looking at your file, you grew an inch. Now I'm going to just listen to your heart. Okay. Okay, so I have this here. I'm gonna put this on your heart, and I just want you to breathe normally for me. Very good. Just keep breathing. Good. Okay, now I want you to take 3 deep breaths, okay? All right, let's begin. Let's do the first one. Very good. Let's do the second one now. Very good. Now let's do the third one. Perfect. Okay, now I'm just gonna go up behind you with it, okay? Now I want you to breathe normally. I'm gonna be listening to your heart and your lungs now. Okay, keep breathing normally. Okay, now I want you to do 3 deep breaths again, okay? Alright, let's do the first one. Okay, very good. Now let's do the second one. Very good. Now let's do the third one. Very good. Okay, so your heart and your lungs sound fantastic. Very good. I'm just going to check your eyes now. Okay. So I'm just replacing the top of this. Okay, just turn it on. Right, just look forward for me. Try not to blink. Good. Same thing. Just look forward and try not to blink. Very good. I'm gonna look back at that first eye. So, can you look up for me? Good. Can you look left? Can you look right? And can you look down? Perfect. Let me look at this eye now. Okay. Can you look up for me? Can you look right? Can you look left? And now, can you look down? Beautiful. Okay. Now, Is the light too bright for you? Is it bothering your eyes at all? Okay. Can you just look at my nose and let me know when the light enters your vision? So we're going to be checking your peripheral vision now. So just tell me when it enters your vision. Good. Mm-hmm. Mm-hmm. Good. Mm-hmm. Okay. Perfect. Now just keep looking at my nose. Let me know when the light leaves your vision, okay? Good. Very good. So I have this red light here. So I'm gonna put it around your vision like this. I want you to tell me if it's up, down, left, or right. Okay. You look at my nose. All right. Perfect. All right. I'm going to be covering one of your eyes, and I want you to read the smallest line that you can read. Okay? Very good. All right. Into the other eye. Okay. So what is the smallest line you can read? Good. Now we're going to do it with both of your eyes. Okay. Can you read this line for me? Very good. Can you read this line? Good. Now we're going to really try to read that bottom line, okay? Just do your best. Okay, good try. Can you tell me the two colors here? Good. Okay, I'm just going to take this paper. So right here, it's a measurement of your pupils. So I'm just going to compare your pupils to this. So just open your eyes wide. Just want to measure your pupils with this. Good. Okay. We're going to do one more thing with your pupils. I'm just going to be measuring your pupils. Okay. All right. Very good. Just measuring the distance between your pupils. Okay, so now I'm going to cover your eye again. You see my hand here? Good. I want you to tell me how many fingers I'm holding up. Perfect. Okay. How many fingers I'm holding up? Good. Same thing here, covering your eye. I want you to tell me when you see the red light blink. Good. Now let's do this other eye. Same thing. Tell me when the red light blinks. Perfect. We're gonna kind of do that same thing here. So I have this that's gonna cover both of your eyes, and there is kind of an opening, just little dots on one eye. And when you see the light, let me know, okay? So we're gonna do 2 rounds. One light is gonna be super, super bright, and then the other one is gonna be kind of tinier. Okay, so we're going to be testing it here. I'm just covering this eye. Let me know when you see the red light. Good. Let's replace this one to the other eye now. Okay, let's begin. Good. Now we're going to be doing the same thing with a light. However, this one's going to be a bit different. It's going to have a beep sound with it. So sometimes when you hear the beep, you'll see the red light. Sometimes you won't. So you have to be very careful, okay? I'm covering your eye. Let me know when you see the red light. Yeah, it's very, very small and dull. Very good. Now let's do the other eye. Very good. That one was a bit challenging than the other one. It's a bit more challenging, so you did get one of them wrong, but that's totally okay. Alright. Now, what I'm going to do is just test your sensitivity to air with your eyes. So I'm just going to open your eyes. I'm going to blow some air, so just try to relax. Good. So one more time. Very good. Other eye now. Try to relax. Good. Perfect. Alright, we are all done with your eyes now. Now we're going to be just checking your hearing out. Let's see. So for a lot of this portion, I need you to have your eyes closed. Close your eyes. Okay, so I'm going to be making different sounds, and I want you to tell me what side you hear that sound. It's going to sound like that. So it's a little click. All right. So when you hear that sound, let me know what side you hear it on, left or right. All right. Keep your eyes closed. Let's begin. Very good. Okay. Now, same thing. I'm going to be making a beep sound, and I want you to tell me what side you hear the beep. Perfect. Okay. Now I'm going to be whispering some words in your ear, and I want you to tell me what word I'm saying. Okay? Get closer. Okay. Dreams. Dreamy. Sleepy. Sleepy. Strawberry. Strawberries. Pineapple. Pineapple. Roses. Rose. Scratch. Scratching. Very, very good. So that was perfect. Now I have a tuning fork, and you are just going to tell me when the sound stops, okay? All right, let's begin. Very good. Let's do the other side. Perfect. Right. Now I'm going to be making this sound, so I want you to tell me when you hear that sound, okay? Let's begin. Perfect. Okay, I'm going to just touch your ears gently. Let me know if you feel any pain. Very good. Now I'm going to use this hammer. I'm going to press against your ear. I want to see the sensitivity of your ears. Any pain? Great. Let's do the other ear. Okay. Any pain? Perfect. Okay. So we are done with your yearly exam. You did fantastic. I didn't see anything that's concerning or anything to worry about. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening, okay? I'll see you around. Bye-bye. Hi, today we are going to be doing a cranial nerve exam on you. Is there anything you would like to tell me before we get started? Okay, so we're just checking it out, making sure everything's okay. I'm just going to start putting on my gloves and then we get right into it. So you've had nothing concerning happening lately, right? Okay. All right, so it's like kind of a yearly checkup for you. Nothing really wrong, just making sure everything's okay. All right. Okay, I got my gloves on and I'm just gonna start by getting your temperature. I have two temperature guns. This one's gonna go in your ear and the other one's just gonna go on your forehead. So just stay still. It's gonna go inside your ear and you'll hear a beep. Okay, good. Okay, good temperature here. Let me check the other ear. Okay. Okay. Good temperature on both ears, but we always want to double check. So I have this other temperature gun that's just going to go right on your forehead and the sides of your cheeks. Okay, stay still. Good. Good. Perfect. And right here, the temperature is good as well. Not concerned about anything there. All right. So I just want to check out your eyes. So I'm just gonna look with this light. Is the light too bright for you? Okay. All right, can you follow the light? Very good. Let me know when the light leaves your peripheral vision. So I need you to look at my nose and keep your head straight. Don't move with the light. Just let me know when it leaves your vision. Good. Good. Okay, now let me know when it enters your vision. Good. Okay, done with that light. I'm just going to quickly take a look at your pupils, making sure that they're both like an even size, that there's nothing wrong with them. So I'm just going to this. Okay, I'm just gonna get kind of close. All right, try to keep your eyes open. Okay, can you look up for me? Can you look right? You look down. And can you look left? Very good. You can blink, blink, blink. Okay. Let's do the other eye. Okay. Same thing. Try not to blink and look up for me. Okay. Good. Look down. Look left. And look right. Great. Very good. I think I'm starting there. I'm going to cover your eye. And I want you to look at my hand. You can see my fingers, correct? Great. I want you to tell me how many fingers I'm holding up, okay? All right. Let's begin. Good. Let's do the other eye. So right here. Okay. Ready? Good. Fantastic. Can you tell me what color this is? Good. What color is this? And what color is this? Perfect. Okay. I'm gonna cover your eye again. So I have this here, and I want you to read the smallest letters you can see. Okay? Very good. Now we're going to switch sides. I want you to tell me the smallest letters you can see. Very, very good. All right. So I'm just going to take this light. Okay. So I want you to look at the white light. Now look at the red. Look at the white light. Now the red. Okay. I want you to look at this light and tell me when the red light turns on like that, okay? So just keep looking at the light. Don't look over here, okay? Let's begin. So I want you to count how many times, okay? Good. That was 6 times. Let's do this side. So just look at the light. Don't look over here, okay? Let's begin. Perfect. That was 8. Okay. Now I'm going to tell you some instructions. All right. So I want you to start by looking at my nose. Okay. Now look at the white light. Good. Now look at the red light. Look at my nose. Look at the white light. Don't get distracted, okay? Keep looking at the white light. Look at the red light. Look at my nose. Keep looking at my nose. Okay. Look at the red light. Now the white light. Okay. Keep looking at the white light. Okay. Very good. Okay. All right, now look at my nose. Tell me when you see my hands move like this. Okay, they're going to be in your peripheral vision. Just look at my nose. Good. All right, we are all done with your eyes, so now we're going to be looking at your ears. I'm going to start off by looking inside your ear with an otoscope. So just let me replace the top of this tool so that we can make it an otoscope. Okay, the top just fell off. Okay, let's put the top on it. Perfect. Okay, I'm going to be looking inside your ears with this otoscope. All you need to do is stay still, and if you feel any pain, which you wouldn't, just let me know, okay? Alright, just stay still. I'm going to look at this ear first. Great. Now I'm going to be looking at the other side. Stay still. Very good. Looks pretty good. I didn't see any redness, any bumps, anything stuck in there. I didn't see any wax buildup. So your ears look great. Now I'm going to be observing the outer of your ear. So I have my light. I'm just going to rub up against your ears, okay? All right. You can feel me touching your ears, right? No pain either. Okay. Let me try the other ear. So you're not feeling any pain here either, and you can feel me touching your ear, right? Great. Very good. Now I'm going to test your hearing. I have this tuning fork, and all you have to do is tell me when the sound stops, okay? Alright, let's begin. Very good. Very good. going to do another test. Let me know when you hear this sound. So count how many times you hear it, okay? How many times? Perfect. Now we're doing the other ear. So let's cross that one out. Let's begin now. How many times? Perfect. So we're actually going to do a more in-depth hearing test now. I'm going to put these headphones over your ears and you're going to go through different beep tests and you're going to tell me whatever the answers are. There's going to be different types of questions, so I'll let you know during each set, okay? So I'm just going to put these on.
Good. Okay. Well, we're gonna begin. Alright, so for the first test, you're gonna let me know when you hear the sound, okay? So for this one, it's gonna be what ear you hear the sound, okay? So tell me left or right.
You did fantastic. Your hearing is really, really good. So now I'm going to test your face. I have this little hammer here. I'm just going to press it against your face. I want you to tell me when you feel um, the hammer on your face, okay? All right, let's begin. Very good. Alright, same thing kind of. So I have a dipper hammer and I have a fan, and we're gonna do if it's soft or hard. Okay, so this fan is gonna brush it up against your face like that, and the hammer is gonna So I want you to tell me what you're feeling. Okay, so this one I need you to close your eyes. All right, let's begin. What was that? Okay, that was the fan. And that the hammer. Okay. Good. Okay, perfect. Very good. Okay, I'm just going to touch along your face. I'm looking for anything that is painful, any bumps or bumps. Okay. Very good. Your face looks awesome. Okay, now I'm going to do a taste and smell test. So I have this here. I'm not gonna look at the front. I'm gonna leak the smell. Okay. So I'm going to just spray this. Okay. What does it smell like? Okay. It smells like roses. Roses. You can see that. Roses. Very good. Okay. Here, let's see. We have another one here. Okay. Now let's spray that. Okay. What does it smell like? It smells like caramel. Very good. Next one I have is here. Okay, let's take a smell. Okay, so this was a trick question because we already had this smell, but this one's also roses. So there's rose petals in here. Very good. Now we're gonna do a taste test. Okay. Open this. Okay. I'll just put this on your tongue. Open wide. Good. What does that taste like? Very good. Strawberries. Okay, let's do the next one. Okay, open wide. Oh, what does that taste like? Banana. Very good. One more. And what did that taste like? Coffee. Very good. You did fantastic. So lastly, we're going to do kind of like a coordination test. So I need you to close your eyes, okay? I want you to take your finger and touch your nose. Okay, very good. Now I want you to touch your forehead. Good. Now I want you to open your eyes, reach out and try to touch my finger. Very good. Now I want you to just look at my nose and I'm gonna go super close. Okay, just follow my finger. Good. Okay, everything looks really, really good. I'm not concerned about any of your cranial nerves, so I'm just going to write that down. Yeah, the appointment went super well. I'm not concerned about anything. Your hearing was perfect, your eyesight, smell, taste, coordination, everything was awesome. Also, it doesn't look like you have the flu, the fever from the temperature. Okay. Okay. And that is it for our appointment today. Thank you so much for letting me examine you. You did fantastic. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening. All right, I'll see you around. Bye. Hi there, welcome in. Let me just start taking some notes here. Okay, so you are here for your yearly doctor exam, correct? Okay, can you give me your first and last name? Okay. Okay. And what is your birth date? Okay. Okay. And anything new that we should know about? Any sicknesses? Any concerns? Okay. All right, we can get started right away. I'm just going to put my gloves on, and I'm just going to just examine you, make sure everything is looking okay. Okay, so let me put on my gloves. Okay, first glove on. Let me get my second one now. Great. Okay, so what I'm gonna just do first is I have this temperature gun. I'm just gonna get your temperature quickly, making sure you're not sick at all. So just stay still for me, okay? You're gonna hear a beep, and that's when we're done. Just give me a second. Okay. All right, we're gonna do the same thing on the other side. So just stay still for me. Okay. All right, just give it a little bit and then we'll leave. All right, we have a good temperature here. Not really concerned about you getting sick at all or being sick. And okay, now I'm going to hear your heart and your lungs. Okay, so I'm just gonna put this on. All right. Now I want you to just stay still and breathe normally for me. Okay, just breathe normally for me. Just breathe normally. Very good. All right, now give me 3 deep breaths, okay? Ready? Good. Let me get another one. Very good. And one more. Very good. Okay, now I want you to cough for me. I just want to see if you're wheezing or not, if I can hear that. Let's just do 3 coughs. Okay, 1, good. 2, good. And 3. Very good. Okay, now I'm gonna test listen to your heart on the back side of you. Okay, so just relax. Just breathe normally for me. Very good. Just keep breathing normally. Okay, good. All right, now I want you to take 3 deep breaths for me. 3. Okay, ready? Let's do the first one. 1. Let's do the second one. 2. Now let's do the third one. Very good. Okay, now I want you to take 2 coughs for me. Or 3 coughs, sorry. Okay. Let's begin. 1. Good. 2. 3. Very good. Okay, everything sounds good. Not worried there as well. Now let me get your blood pressure. Let's test that. Okay, so I'm just going to wrap this on your arm. Just stay still, keep it flat on the table. Okay. This arm's good. Alright. Let me just get this set up quickly. Alright, let's go. Good. Okay. Just see how it's going. And let me take a listen to your arm here. Okay. Very good. Sounds good. Now let me get rid of the air here for you. Okay. Great. Now I'm just going to look inside your ears. So I'm going to get my otoscope set up here. Just going to put the top on. So now I'm going to look in both of your ears. I'm just going to make sure that nothing's clogged, no redness, or anything concerning. Okay, so just stay still. Let me look inside. Okay, very good. Everything looks good inside your ears, or your first ear. Let me look at your other one to make sure that one's okay too. Okay, stay still. Alright, everything looks very good in both of your ears. I'm not seeing wax buildup. I'm not seeing any redness or anything concerning there. So your ears look really, really good. Now I'm just gonna focus on your eyes quickly. Just gonna look at your eyes. So we have this light. Just follow it. Just with your eyes, not your head, okay? Just your eyes. Okay? Now I want you to look at my nose and tell me what side you see the light, okay? Good. Look at my nose. Good. 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 Okay, now tell me top or bottom. Mm-hmm. Very good. Okay, I want you to tell me when the light leaves your vision, so look at my nose. Okay, very good. Now I'm going to look at your eyes a little bit deeper. So I'm just going to take out this tool here. Okay, I'm just going to look at your eyes. Okay, try not to blink here. Good. Let me look at your other eye. Try not to blink. Good. Okay. Now, I want you to keep your eyes open here, so no blinking. I want you to follow my instructions, okay? All right, so I want you to look up for me. Now look down. To the left, please. And to the right. Good. Okay, same thing, just with your other eyes. Don't blink, okay? Try not to. All right, so I want you to look up for me. Very good. Okay, now look down. Look right. And look left. Great. That looks really, really good. So I'm going to cover one eye. And here, my hand, I want you to tell me how many fingers I'm holding up. Okay? Now let's begin. Very good. Now let's do the other eye. Same thing. Tell me how many fingers I'm holding up. Oop. Okay. Very good. Okay. Now I want you to tell me which one of my hands is moving, okay? So which hand? Good. 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 Very good. All right. I'm going to test your eyes. Have this tool here. Just going to change the color. So I want you to look at this dot, all right? So I'm gonna cover one eye. So just look at the dot. It's gonna get really close. Just keep staring at it. Keep staring. Good. Okay, covering your other eye, same deal. Just keep looking at the light. Keep staring at that black dot. Very good. Keep staring at it. Good. Very good. Okay, one more time. We're just going to do a different color. Okay. Now we're going to do red. We're going to stick with, actually, let's switch. Go back to this eye. Okay, just keep looking at the dot, the black dot. Don't blink, don't blink. Good. Okay, now we switch. Okay, just keep looking at that black dot. Don't blink, don't blink. Very good. Good. Okay, just want to test your eyes, how sensitive they are to light, and it looks pretty good. Let me see. Now we're going to do one more test like that. This one, I need to cover your eye. So just relax. One eye's covered, and then one eye has these like little dots that you can see through. So what I want you to do is just tell me when you see a red dot. So that was very light. Let me do a different one. One second. Try it this way. Alright, so tell me when you see a red dot like this. Okay, it's very light, so you might have some trouble with some of them. So just tell me when you see it, okay? Very good. Some of them were hard, some of them were very light, and then some of them didn't even have a red light. So you did very, very good. We're going to do the same thing, but with your other eye. So get that ready. Okay, same thing. Let me know how many times you see the red dot, or when you see the red dot. I'm sorry. So when you see the red dot, let me know. Very good. You did very good that one too. Like I said, some of them didn't even show. Some of them were very, very light red dots. So you did fantastic. Now we're gonna just move on back to your ears, and we're gonna do some hearing tests. I have a tuning fork, and I want you to close your eyes and let me know when the tuning fork sound stops. Okay? All right. your eyes and let's begin. Good. 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 Okay, so now I want you to keep your eyes closed and you're going to hear this sound that I'm making with my hand and you're going to tell me on what side you hear that sound. Okay? Great. Okay, let's begin. Alright, very good. Same thing, but we're going to be doing it with a beep. So tell me what side you hear the beep. You can open your eyes now. And that was the end of your exam. You did fantastic. I'm just going to write down everything was perfect. Nothing to worry about at all. All right. So it was very lovely to meet you, and I hope you have a lovely rest of your evening.